Cerebral palsy is a neurological condition that affects muscle control, coordination, and movement. It is caused by damage to the developing brain, usually occurring before, during, or shortly after birth. Symptoms may vary widely, including difficulties with movement, muscle stiffness, poor coordination, and balance issues. What are the causal factors of cerebral palsy, and can it be prevented? Cerebral palsy can have various causal factors, including genetic mutations, prenatal infections, birth complications, and brain injuries. While it may not always be possible to prevent cerebral palsy, steps can be taken to minimize risks, such as proper prenatal care, immunizations, and prompt treatment of infections. Spastic cerebral palsy. This is the most common type, characterized by muscle stiffness and tightness. This is caused by damage to the brain before birth, during delivery, or within the first few years of life. Dyskinetic cerebral palsy. Individuals with this type experience uncontrolled and involuntary movements. This is caused by a brain injury that occurs during late pregnancy or the early birth period. Ataxic cerebral palsy primarily affects balance and coordination, resulting in shaky movements. This is caused by a brain injury to the cerebellum before, during, or shortly after birth. Mixed cerebral palsy. Some individuals may exhibit a combination of two or more types. Cerebral palsy poses unique challenges. Let's explore some of them. Mobility challenges. Individuals with cerebral palsy may require mobility aids, such as wheelchairs, crutches, or walkers. Communication difficulties. Some individuals with cerebral palsy may have challenges with speech and may rely on alternative communication methods. Fine motor skills. Tasks involving precise movements, like writing or buttoning clothes, may be challenging for some individuals. Activities of daily living. Simple tasks such as dressing, eating, and bathing may require adaptive equipment or assistance. How is cerebral palsy assessed? Diagnosis of cerebral palsy typically involves a thorough medical history review, physical examination, and assessments of motor skills, coordination, and muscle tone. Medical imaging techniques like MRI or CT scans may be used to visualize brain abnormalities. What are the intervention and education approaches for individuals with cerebral palsy? Rehabilitation therapies, including physical, occupational, and speech therapy, improve mobility, communication, and overall quality of life. Assistive devices and technology, such as mobility aids, communication tools, and adaptive equipment, can help individuals with cerebral palsy overcome challenges and enhance their independence. Individualized education plans are tailored education plans that outline accommodations and support for students with cerebral palsy to ensure they have equal access to education. Providing emotional support through counseling, support groups, and peer networks is vital for the well-being of individuals with cerebral palsy. Let's explore a perspective on intervention for individuals with cerebral palsy. Early intervention is crucial for maximizing potential and minimizing limitations. Early therapies and interventions can positively impact developmental outcomes. A multidisciplinary approach involving collaboration among healthcare professionals, educators, and families is essential for providing comprehensive support and care. Individualized approaches considering each person's unique abilities, strengths, and challenges are vital in intervention planning. Living with cerebral palsy comes with its own set of experiences and challenges. Let's debunk some common misconceptions and gain valuable insights. Myth: cerebral palsy is a mental health condition. Fact: cerebral palsy primarily affects physical movement and does not impact intellectual abilities. Myth: individuals with cerebral palsy cannot live fulfilling lives. Fact: with appropriate support, individuals with cerebral palsy can lead successful and fulfilling lives in various domains. Myth: cerebral palsy is always progressive. Fact: cerebral palsy is a non-progressive condition. However, secondary complications may arise over time. Let's gain valuable insights into living with cerebral palsy. Emphasize the importance of self-advocacy and empowerment for individuals with cerebral palsy. Highlight stories of resilience and achievements of individuals with cerebral palsy to inspire and motivate society and individuals with cerebral palsy. Encourage society to foster inclusivity, promote awareness, and support organizations dedicated to improving the lives of individuals with cerebral palsy.